team who went to New York and worked with the ICU at Northwell Health. Shall we qualify Jacob Ferran? Jacob is a pediatric ICU nurse at Children's Hospital. He also was in New York and worked with many of the nurses who are here in Salt Lake. And then we'll turn over the time to our friends and colleagues from Northwell Health. Adari Brahamson is a Northwell Health nurse. Madison Monteg is a Northwell Health nurse. Anise Sterling is also a nurse from Northwell. And then Sharia Barbera is a nurse from Northwell Health. So they'll get up and share some of their perspectives and thoughts about being here and this really unique and important collaborative relationship that Intermountain and Northwell Health have. And for those of you who may not know, Northwell Health treated actually more COVID patients than any other facility or system in the nation during their situation in New York. So with that, we'll turn the time over to Dr. Paul Krakovitz.
Thank you, Northwell Health, and thank you to the nursing staff that's come. We're very excited that they're here at Intermountain. We are very fortunate in a state because we have great health care. And this pandemic has brought a lot of stresses to everybody across all society in every sector of what we do for life. And one of the bright spots that's come of this is our friendship that's developed with Northwell Health. If you recall, back in April, we sent 100 caregivers to New York. Many of those went to Northwell. And Northwell's been a very, very busy system in New York. They've treated over 70,000 COVID patients, which is a real incredible amount of expertise that they've developed. They have seen more COVID patients than anyone in the country. During their massive surges, when we were able to send our caregivers and able to give them help, which they needed, and we learned a lot from going there. And I think they learned some things from our caregivers here. We've been treating patients with COVID since March, and we've learned quite a bit on how to do that. Our hospitals are busy. We are not at a surge level right now. And I like to repeat that. We have busy hospitals, but we are not in a surge. We realize, though, by our friendship with Northwell, that the best time for us to learn from them and then for us to share best practices back is during a time where there's relative calm. So by having them here, we can learn and they can learn from us. And we're really, really excited that they're able to come. There'll be a total of 30 nurses that will be coming to Intermountain. Our first wave of 10, our pioneers over here, arrived over the weekend and they started working. They'll be here for about 2 weeks. And then the next group will come and the group will come after that. This will give us an incredible way to collaborate. So I'd just like to finish by saying thank you. We're really excited about this partnership with Northwell. And what's come from the pandemic is our ability to share from across the country, from New York to Utah and Utah to New York. So thank you again for coming.
So I had the honor and privilege of being in the first group that went out to New York in April. Seems like a million years ago as far as the timeline. But one of the things I want to point out is what was going on in April and March and April, how we treated patients, what we've learned since then. Things are a lot different. We have better survivals now. They have better survivals. I've been in communication with the ICU doctors there. We are learning more and more about how to change this very complex disease. So I'm excited to have collaboration with this group of fine nurses. They're amazing, I'm telling you. So that we can see what they've been doing recently. They've learned so much more. They've had so much more experience in seeing all the unusual types of presentations of this disease. So it was a true honor to get to go. And I kind of have a little glimpse of what it's like for them coming here. I want to share a story with you that was shared by me from one of my pulmonary colleagues. His father is a family practice doctor, has passed away now, and he actually served in World War II. And at the time he was serving World War II, it was in London. It was during the bombings, the V bombings, the nightly air raids. It was a very difficult time. 40 years later, he went back to visit London, see what London looked like, see how it recovered. And he went up to the bar that he normally went to after his shifts, went to the bar, saw the bartender, and the bartender looked at him and said, "Will it be the usual, doctor?" And the doctor went along and said, "Sure, it'll be my usual." Next thing you know, glass was brought out, scotch was poured, a little bit of water, a couple of rocks. It was his favorite drink. The doctor asked the barman, "How did you even remember this after 40 years? And the barman said, "You have left your family 40 years ago to come here and work in our city and help us out. The least I could do is to remember your favorite drink." So, like the barman who acknowledged leaving your family, going and living in a hotel, coming and working collaboratively with us, I want to thank you guys for leaving your families to come work with us and to help share best practices and learn from each other. And I want to thank Northwell for doing this, thank Intermountain for this ability to learn from each other. I'm very excited about this opportunity.
Thank you, Dixie and Paul. My name's Jacob Ferran. I am currently working right now in the pediatric ICU at Primary Children's. And my background before that was working in the respiratory ICU here at IMC. I am overwhelmed with gratitude for this team who has traveled out to help us. When I went to New York and when I chose to be part of the first team to go to New York, I went out of a sense of duty to country and to help people on the worst days of their lives. And I think many of us who chose to go into healthcare chose to do so out of a desire to simply help others and to help patients and their families. When I chose to go to New York, Utah was in a state of relative ease in terms of COVID-19 cases, and the city of New York was overwhelmed, and their hospitals were overrun by so many cases. And our team was fresh, and we went into the fray wanting to help. And I just can't stop thinking about how this team has come to help us after one of their darkest hours, which to me speaks to the tenacity of the human spirit. So thank you. While I was in New York, I saw a lot of death and strife and suffering. And in a time of so much polarization and isolation, the very fact that we have frontline people who are willing to travel across the country to help others out, to me speaks to the fact that we can be unified even while we're separated and socially distanced. Again, I can't thank you enough for leaving your families and coming to help us. And we're excited to learn and share knowledge with you guys and to gain experience from what you've seen as well. So thank you, and thank you all for being here.
Hello, everyone. My name is Adari Brahamson. I'm from New York. I work at Long Island Jewish Medical Center. And I just want to start off by saying how grateful I am that you guys have been so kind and warm and welcoming. Everybody that I've met truly on the streets, 7-Eleven, the hospital, you all have been amazing. So thank you. But really, I have to say the number one thing that I have been asked in this process is why? Why am I doing this? Why am I coming back and doing this again? And honestly, it's just a very simple answer. I feel I need to give back. You guys came and helped us when things were really picking up, and there's no words to describe the things that we've seen and we've gone through. And it's really important to give back to your team. Obviously, we want to help the community. Patients are number one priority, but nurses, we band together. And if any of you are struggling, I know I speak for my colleagues, like we're here to help one another. So sincerely, thank you from the bottom of my heart for having me. It's very humbling experience. So thank you.
Hi, everyone. My name is Madison Montag. I'm a CT ICU nurse at Lenox Hill Hospital in Manhattan. I think that the biggest thing that I want to just echo is thank you to everyone. The way that we got through COVID in New York was with the help of all the care providers that came from Intermountain, from all the other destinations. When we were at our lowest point and we were struggling every single shift, the way that we got through it was by leaning on each other. I saw something yesterday that was nurses helping nurses, and I just loved it. That's exactly what we're doing here. That's exactly what you guys did for us. And it goes even farther. It's doctors, it's PAs, it's respiratory, it's patient care associates, it's everyone. It's family, it's friends. We all really got a good glimpse into what humanity can be, I think, in that, especially in New York and here, everyone is so kind and compassionate and welcoming. It's just more than we could have ever asked for. And we're really excited to hopefully get to learn here and share what we've learned. And I think we're all really grateful to Michael Dowling, to Governor Cuomo, to our managers, to our team who's supporting us while we're gone, and especially to the team here that welcomed us in. We all got to visit the units yesterday, and they were so welcoming. They showed us exactly what we needed to do. They really set us up for success. And I think that that's just to echo exactly what Adair said, that we're here to help, and whatever we can do to be helpful, we're happy to do. And I think that that's why most of us did it. So thank you guys, really, from the bottom of our hearts. Thank you.
Hi, everyone. My name is Anise Sterling. I'm a coronary care unit ICU nurse in LIJ Medical Center. I just want to first and foremost say thank you. Thank you all for having us, and thank you for extending help when we needed it. The COVID crisis for us was definitely a tough time, and reflecting on it, it makes me very, very, very emotional because it was very tough for all of us. We were going home exhausted. We were at work, and a few days ago, one of our coworkers, Magdalena, said that for a while we were going to war, not to work, and that says a lot. And I think the biggest question that I've heard more and more when I decided to come here is why I decided to do this. And I don't remember their names, and I wish I did. But the Intermountain people who helped us, the nurses who helped us, who came when we needed help, that to me was the most amazing thing you could do when we had no idea what was going on. Everything was a fight. And for them to extend that help and that gratitude to us, I felt that it was extremely important to return the favor. I would definitely want to just say thank you for having us. Thank you for extending hospitality, and thank you for the warm welcome. And I appreciate it. Thank you.
Hello, everyone. My name is Shreya Barbera. I work at the medical ICU. It's outside. It's Bayshore, New York. Thank you once again for having us here. I have to say, it was such a relief when the Intermountain group came to help us. We were at our peak. We were overrun in the hospital. Our ratios were 1 to 4, 1 nurse to 4 patients, which was double what we're used to. And some ships it would even be triple. And you want to do what's best for your patient. And it's when the Intermountain group came, it gave the relief. It was able to bring down the ratios, and it was very helpful because a big part of nursing is team nursing. It's helping one another with your patients. It's knowing that when one needs most help, everyone is able to drop what they're doing and help you. I was very grateful for my own team. They always had our backs, and the Intermountain group became part of my team, and it was such a relief, and it was good to debrief after our shifts. And I think that's what gave us resilience, was each other. So now to be in Utah, after finally we got our numbers under control, and I'm grateful for the efforts that Cole gave to us to make sure that we had our equipment, we had PPE, and now that I can come back and help out my team again. So thank you once again, and I'm looking forward to learning. Thanks.
All right, we'll open it up to questions now. Just a couple of notes. There are additional nurses who are actually working in the ICUs this morning. So the nurses who are here with us are starting shifts tonight and tomorrow. So they spent yesterday in orientation and going through and getting familiar with the units and the practices here. And so they're now ready to go. Dr. Krakovitz, if you can come, Dr. Paul, if you can come up here, I'd like you, before we take some questions, explain kind of what they're going to be doing specifically in our units. How are they going to be working with us and collaborating on the knowledge and experience for COVID care?
Sure. So these are highly trained intensive care unit nurses, and we have highly trained intensive care unit nurses. They're going to be helping out with COVID patients and non-COVID patients, and we'll be sharing best practices. It's pretty simple. It's just caregivers doing exactly what they're great at, which is taking great care of patients, both from the emotional side as well as from the clinical side.
Any other questions for Dr. Krakovitz?
Okay, thanks.
Okay, questions for our nurses. Why don't we have you guys come over here? I know some of you want to do one-on-ones. Why don't we have the nurses come on over? And is there any questions for any of them that you'd like to ask? Yeah, Ashley.
I'm sorry,
we can't hear you.
So one of the things I noticed when we first had so one of the things I noticed when we first didn't know anything about the disease, we weren't, the standard was to, if oxygenation were to not give them any oxygen therapy that would cause aerosolized COVID particles. So that meant that we wouldn't be able to do high flow nasal cannula, delivers a lot of oxygen, a lot of liters of oxygen within minutes. And we weren't able to do BiPAPs, which was the last resort after before we would intubate patients. It was either a non-rebreather, which was 100% oxygen, or you had to intubate them. So now I think with negative pressure rooms, we're able to give these other options before we would intubate people, and it has prevented a lot of intubations, which has its own complications. People get ventilator-associated pneumonia and just worsens the condition. So with these new options, and then also patients are self-proning. So before they would be intubated, instead of us flipping them. They could do it on their own while they're sleeping. For even 15 minutes would make a big difference. As far as medicine and other therapies, it's hard to give, you know, it would be an anecdote. There needs to be more research. But I can tell you from our experience, oxygen therapy before intubation is what we see now. Yeah. Thank you.
Can you all talk about what has changed for you all in the last 6 months as far as the way you approach nursing, the way you approach the profession?
For us, I think just the distancing at work as well, and us wearing masks all the time. Usually in the hospital, we'd wear masks during flu season if you didn't get a flu shot, and now it's, even though we have COVID patients, they are in their separate rooms, but we still wear masks all around the hospital, our N95s as well as our surgical masks. So that's been the biggest change in practice. Even going on break and the way that we organize in the hospital has been different. Just figuring out best times to go on break so that we're not like colonizing in the break room together. And I just have seen that we have gotten so much closer together as a unit. There are nurses that worked downstairs in an ICU that I'd never seen before, but because we had so many ICUs that were created during COVID, we got to learn and meet so many different people. So now walking down the hallway, we can say, "Hey, how are you?" And even though we are only seeing eyes during COVID because we all had masks on, you realize how close you got to people during that time, because we really had to lean on each other. And that's been, I would say, probably the biggest change in our practice and the way that we've gone about and figured out how to work after that.
Anyone else want to address that?
Sure. So we all went into nursing for the same reason, to help people and to make sure that we did our best to give back to the people who helped make us and get us where we are. So after COVID, we got to see a lot of changes within the healthcare system, and it told us how much more we would have to be prepared, and how even different hospital systems would have to work together in the nation to be prepared for any worst case scenario, so that we would be able to better handle whatever situation was at hand. So it taught us a lot.
Could you say your name? I don't know if it's on the press release.
Sure.
Okay, thank you. Any others want to address that?
So being in a hospital as a patient is very difficult, even when you don't have COVID. But when you are so sick and now you are all alone, no one can visit you. You are without your family, you are without your support, you are there without your loved ones. We, as nurses and other healthcare workers, except for the clinical work that we do, we became the family for the patients. We were the communicators. We were the ones going in with the iPad trying to connect grandma and grandpa and mom and dad and everybody else. So what we've learned all together, nurses, is that there's so much more into nursing than just the clinical and our knowledge, which is, of course, incredibly important, but the humanity behind it and just the love for people. We all love life. Being there for them was the biggest achievement that I think we've accomplished.
Any other questions for the nurses? Okay, I will let you know that we will be doing a press conference in Spanish for Spanish-speaking media, and we have our honor to have Dr. Luke Providence, Intermountain Park City Hospital, who is fluent in Spanish, and he'll be doing that in just a moment. So if you do want to have some one-on-one interviews, feel free to let's go ahead and do that. But again, please maintain social distancing and keep your masks on. So, again, thank you for being here today. Erin, do you have anything to add? There's some B-roll.
Yeah, I'll send out an email with the full press release with links to some video of their orientation as well as ICU video.
Thank you all for being here.
Thank you.